General anesthetics. What is the definition of general anesthesia? It refers to drug induced reversible loss of consciousness and all sensations. So, it is because of a drug and it is a reversible loss of consciousness and all sensation. Consciousness and all sensations are lost. So, general anesthesia refers to drug induced reversible loss of consciousness and all sensation. The features of general anesthesia are reversible loss of consciousness, that is, reversible unconsciousness, reversible loss of sensation, also analgesia and amnesia. Amnesia means loss of memory, muscle relaxation, and abolition of reflexes. So, these are the four properties of general anesthesia: reversible loss of consciousness and sensation, analgesia, amnesia, muscle relaxation, and abolition of reflexes. So, there is no single anesthetic agent that will produce all the above effects. That is, there is no single anesthetic agent जो ये चारों properties show करे, जो जिसका ये चारों effect हो. And that's why anesthetic protocol includes pre-medication, induction of anesthesia, induction by for example propofol, it is an inducing agent, then maintenance of anesthesia, N2O plus isoflurane, skeletal muscle relaxation, analgesia as pre-medication during and after the operation, then use of other drugs to reverse neuromuscular blockade and to reverse the residual effects of opioids like naloxone and benzodiazepine, example फ्लूमाजनील. सो ओपियोइड्स के इफ़ेक्ट को रिवर्स करने के लिए वी यूज़ नैलोक्सोन और बेंजोडाइजेपिन के लिए वी यूज़ फ्लूमाजनिल. सो नैलोक्सोन इज़ यूज टू रिवर्स द इफ़ेक्ट ऑफ ओपियोइड्स एंड फ्लूमाजनिल टू रिवर्स द इफ़ेक्ट ऑफ बेंजोडाइजेपिन. ठीक है. सो anesthetic protocol includes pre-medication, induction of anesthesia, for example with propofol, maintenance of anesthesia, example N2O plus isoflurane, skeletal muscle relaxation, then analgesia, and use of other drugs to reverse neuromuscular blockage and to reverse the residual effects of opioids. We use naloxone and we use flumazenil to reverse the effect of benzodiazepine. So first is pre-medication, induction, then maintenance, then skeletal muscle relaxation, analgesia. Then there's a term minimum alveolar concentration. Minimal alveolar concentration. It is the minimum concentration of anesthesia required to produce immobility. It is the minimum concentration of the anesthesia in the alveoli required to produce immobility in response to a painful stimulus in 50% patients. So, minimum alveolar concentration, it is the minimum concentration of the anesthetic in alveoli required to produce immobility in response to a painful stimulus in 50% individual. Okay, and this minimum alveolar concentration is inversely proportional to potency. It indicates the potency of inhalational general anesthetics. जैसे कि N2O का minimum alveolar concentration is more than 100%. So it's very high. So that's why N2O is the least potent anesthetic. N2O का minimum alveolar concentration is more than 100%. It's around 105%. That's why N2O is the least potent anesthetic. And halothane, it has a MAC of 0.7%. N2O का 100% था, 105% था. ठीक है. और हैलोथेन का 0.75% है. So there's a huge difference. So halothane ka MAC is 0.75%. So it is very potent. Methoxyflurane, it has a MAC of 0.16%, so it's the most potent anesthetic. Methoxyflurane, it has a MAC of 0.16%, so it's most potent. And halothane, it has a MAC of 0.775%, and potency is inversely proportional to minimum alveolar concentration. There are four stages of anesthesia. First is state of analgesia, state of excitement, stage of surgical anesthesia, and stage of medullary paralysis. There are four stages of anesthesia: stage of analgesia, stage of excitement, state of surgical anesthesia. In this stage, all the surgical procedures are performed, and stage 4 is the stage of medullary paralysis. The four stages of anesthesia are state of analgesia, stage of excitement, which is the most dangerous state. Stage of excitement is the most dangerous state, then stage of surgical anesthesia, and the last is stage of medullary paralysis. These stage 1 to 4 are seen with ether because ether is a very slow acting anesthetic. So all these stages are clearly seen in case of ether. There is one more term, that is BG value of anesthetics. So जितना ज़्यादा BG वैल्यू होगा वो एनेस्थेटिक उतना ही सॉल्युबल होगा ब्लड में, और अगर ब्लड में ज़्यादा सॉल्युबल है तो इट विल बी स्लो इन ऑनसेट एंड रिकवरी. सो ईथर का जो BG वैल्यू होता है वो बहुत ज़्यादा होता है. इट इज़ वेरी मच सॉल्युबल इन ब्लड, and that's why it has a slow onset and recovery. See, xenon has a very low BG, it has the least BG, and that's why it is least soluble in blood and fastest. Desflurane, it has a BG of 0.42, and so it is the second fastest anesthetic.